welcome back to the final installment of our three-part series on cannabis and seniors. In this concluding episode, we'll talk about the latest developments and practical considerations surrounding medical cannabis use among seniors. We'll explore recent changes in employment drug testing laws, discussing how they impact cannabis users and what exceptions still apply. Plus, discuss a critical topic, what to do if you or someone you know experiences overconsumption of cannabis, and when it's necessary to seek medical attention. We'll also introduce valuable resources for both clinicians and patients seeking reliable information on medical cannabis. We begin with Dr. Brian Hodgkins, Senior Vice President of Clinical Operations at Desert Oasis Healthcare.
You know, just your comments on this. It's legal in California for both medicinal and recreational use. We are still struggling with, pre-employment screening, people with, who have to drive for their jobs, et cetera. I mean, you guys want to comment on really where should we be looking at this? Should we even care? I'm just curious on this because I've heard a lot of dialogue and debate, pro and con.
I think Paul should take it because we just had a great presentation on this.
All right, Doctor.
Well, the issue really is a couple-fold. One, if you basically know that it has sedative properties to it, then you are understanding that it may be difficult for you to drive or operate machinery. So theoretically, yes, that should be on the label. And labeling is a totally different issue, but it's a mess. We're also trying to look at standards relative to that issue. Regarding the issue of employment, as you may know now, you cannot do a drug test on someone who is using cannabis. The law has protected them, and they are allowed to use it as long as they're not using it on the job. If they use it at home or elsewhere, that's an okay situation. Here's the technical problem. If you measure the drug level in the body, it presumes that they have recently used it because within a couple of hours it's gone. So therefore they're, quote, not impaired. So that's the technical problem, and that's what brought the law forward, and it really has to do with labor laws and lack of discrimination against the cannabis user. There are 2 or 3 groups. Drivers are one, and building trade people are the second that it does pertain to. But other than that, you don't have the restriction that you do. But for the listener, they need to understand that it might impair their driving if they, for example, are using the drug in a car or they've used it within the last couple of hours. Then we can demonstrate some inability to drive carefully. Many years ago, when I looked at alcohol and driving, 1/3 of the accidents were due to alcohol. And so nevertheless, it still had a problem, and it still has a problem today.
Thank you.
I just wanted to chime in and point out, and Paul is correct, but I just want it for clarity. So at the beginning of 2024, Assembly Bill 2186, I might have just screwed that up. I was trying to do it by memory. The point is Gavin Newsom signed a law in 2022 that went into effect in January 1st, 2024, that you can no longer look for inactive metabolites. So that is historically what is found in urine drug screens. So a pre-employment test that looks at urine can technically be looking back 30 or even 60 days in a heavier person and to look at their use. Now, if employers are going to do drug screens, they have to opt for a much more expensive active metabolite test, which could be blood. It could be alternative methods as well, a swab in the cheek. And that window is compressed to much closer to 3 to 5 days, which is much more fair because, you unfortunately could use a much more dangerous, much more harmful, much more addictive drug and be clean in 3 days. But if you smoked marijuana or medical cannabis, you would be 30 plus days. So this is a really big change. But as Paul mentions, there are exceptions. Anyone who needs an FBI background check, anybody who's driving heavy machinery, probably employees. Law enforcement. But we're seeing changes in that too. Used to be you could never have smoked marijuana and become a police officer. Now they're like, not this year? Okay, come on in.
Is there still hope for me?
One of the things I'm finding with seniors is that they need something that is simple, direct, and not complicated. And do you have anything in writing today that can be handed to the physician that they can discuss with one of their senior clients without the seniors having to ask? Is there any kind of do you have anything written that'll give the doctor an intro into making a medicinal cannabis question for their seniors?
We do have a pamphlet. The PCCC has actually, Cody developed the pamphlet. It looks beautiful and it's awesome. And so that is something we do have as one of our something that we could provide from our organization. That would help. So that we're happy to do that, and we can even alter it a little bit to make it a little bit higher end for the physicians.
We'll put it together with that in-person meeting, Dr. Bryan, and we can figure out how to get some of this collateral into your physician's hands.
I found that seniors will read if you give them information they're looking for, rather than using big medical terms, rather than using big terms they can't pronounce, like cannabinoid. Mm-hmm. I can't pronounce half of what the cannabinoids are. I know they're CBD. CBG, CBN, and that's the extent of my knowledge.
We're going to have to drug test Patty.
and you got to say them out loud, too. You're just giving me the acronyms, right?
I couldn't begin to pronounce them.
Cannabigerolic acid.
Oh, God, I hate them. I hate the full names.
No,
it only gets more complicated with the endocannabinoid system.
How simple can you keep your presentation so that, A, it doesn't take up all the doctor's time and they go away understanding what they need to understand so that they can communicate with their senior patients? The seniors have to be approached in a special way without them thinking that they don't know what they're doing. They want something for pain. They want something that's sleep. And this is a perfect Mother Nature medicine. But it hasn't been presented that way. And if you can present it that way, you will save a lot of problems with the seniors ending up in emergency rooms because they took something, they didn't know what they were taking, some cannabis seller across the dispensary that doesn't know anything about seniors. They're teenagers practically, and they're not getting the knowledge that they need to start the cannabis that could be very helpful to them.
Patty, so I wanted to mention one thing about formulation, just because it's usually the formulation that sends the people to the hospital usually. When you inhale, you usually can titrate kind of what you're doing because you can feel it pretty much right away. The biggest problem I see with older adults is actually the gummies. And the problem is because for some older adults, especially because as you get older, your metabolism also starts declining a bit. What happens is it could take between usually about 1 hour, but it could take some of my patients even was as long as 2 hours before the gummy even started working. So what will happen is, they'll take, just like an ibuprofen. It's like, okay, I took 2 ibuprofen. Half hour later, I still have a headache. I'm going to take another couple ibuprofen. You can't do that with edible cannabis.
Right.
You have to take it and you have to wait. So if you want it for bedtime and it can take up to 2 hours, you should take it 2 hours before you want to go to bed and see how it affects. If you're saying, oh, wow, about a half hour before I want to go to bed, I'm getting sleepy. Well, you know that the next day, take it a half hour later to move you back to where you want to take it. But the most important thing is you need to wait a solid 2 hours before taking another form of cannabis, because that edible really can take 2 hours to even start working. And that's what we've seen. And a lot of my patients who I work with, that's what they say. I'm afraid I took too much. It's like, well, and they explain how they did it. And I'm like, well, you didn't wait long enough. It hadn't started working yet before you took your next dose.
Right.
And that's a lot of times what we see with overdose is it's actually the patients taking an extra dose thinking it's not enough, as opposed to the fact that it hasn't started actually working yet.
Is the antidote, when I say for overdose, I just say accidental exposure that exceeds their what their AUC can handle. Is it just time? Is there any? I mean, explain that. What should our senior expect? Should they panic? Should they call 911?
No.
Just go to sleep.
So it's quite the opposite.
Medical cannabis will just put you to sleep if you take more than you
Generally,
should.
Totally right, Patty. Yep, sleep is the most likely outcome in this. Now, the thing is what Leia's describing, this sort of dose. Now, I guess for context, remember I work in the emergency department. I work pediatrics, so kind of the other end of the patient population. But I definitely see individuals who've consumed too much. And to answer Brian's question directly, time. There is no medicine. Now, if you're having really erratic behavior, maybe you co-ingested some alcohol or something like that, you might give a sedative or something to take them down. But really, it's just time. And I want to kind of get back to cannabis has a incredibly wide safety window. It's ridiculous how much cannabis it would take, or THC it would take, to truly harm someone. However, the risk of side effects is at a much lower dose, and so the therapeutic window is rather small. And so we want to how do I want to say this? Oh shoot, I lost my train of thought. But what we were saying was, when we stack these doses and we start to feel very out of control, this can be an extremely uncomfortable situation for individuals. This is why they're coming to the ED. It is primarily in your head. It's a very uncomfortable situation, but it is a safe situation as long as you stay put, continue to hydrate, and take deep breaths. The vast majority of the time, this is really no big deal. But people start to get anxious, and your endocannabinoid system regulates your anxiety. And so with too much THC, it can run off the rails, and we start to have what feels like or could be a panic attack. And that tends to be what lands individuals in the emergency department.
So as long as
Racing heart is another side effect. Yeah.
So
exactly. That's exactly what I was going to say, Cody.
You're planning in the future to have some form of something written as an introduction to seniors that medicinal cannabis can do this, this, and this. It can't do this, this, and this, and you need to start slow and very low in THC content.
Very. Yes.
You
Even
nailed
as
it.
low of a dose as 2 milligrams, people can feel. So sometimes even people can feel 1 milligram of THC.
Well, that's me.
So it's important. Yeah, it's important to remember that. And also, I know that Brian mentioned, I think at the beginning, or somebody mentioned about not being able to find doses. So there are actual doses. They're actually usually CBD dominant with THC. So at dispensaries, you always want to look for that, because I do know that there are products in different states that, including California, even at dispensaries, where they do have 2 milligrams of THC, or usually not less. I don't think I've ever seen less than 2. But I would definitely, but it exists. It's just they are harder to find.
So we're getting up to the hour. Let's just kind of reset for our senior audience and probably some of the clinicians. We talked about the most important thing, which is true in all medicine, is start low and go slow. But if I was going to give you a closing statement, Dr. Lofholm, let's start with you. What would you want to tell my mother-in-law about her desire to experiment with medical cannabis?
Well, I'd like to say the following. My experience is I support 250 seniors in a retirement home. We have had 6 patients per month end up in the ER. They took edibles, and they did just what Dr. Leia said. They took one, it didn't feel any different, so they took another, and then they lost control. So I think it's the loss of control that presents the problem to the patient, and that's the reason that we need to be careful about the dosing issue. We can handle the dose if we have a chance to talk to them about it, but if we don't, they're probably going to get into that problem. And as Cody mentioned, a panic attack really is like being out of control. Disinhibited, as some people would call it, and that's what is fearful for those senior patients. So they need to know as much as they can. We are here to help them get that state of mind and guide them accordingly.
Dr. Johnson, question for you, same?
For your mother-in-law, so I would say, come see me. I see patients throughout the country, so send her my way. But yeah, you could actually, anybody can reach out to, can get any of us or any of the members of the PCCC at info@pcccrx. I think it's .org, right?
Yes.
.org is our email.
We know the insurance companies are not on board yet with covering this as a benefit, medical benefit, pharmacy benefit. But are there consultative fees that you guys charge, or are these gratis for our members?
If it's general info, like, we are always happy to answer general info, such as what is CBG, what is THC versus CBN, or will I get, does this interact with this? We're happy to answer those questions. When it comes to what dose should I use for this ailment, I personally think they should have a full medical workup, and that's what I do for all of my patients. And I recommend that to everybody. I really don't think any medication, whether it's cannabis, herbal supplements, or prescription drugs, should be used until you've done a full comprehensive review of the patient, which is why I'm a much more in the model of thinking to have a pharmacist at dispensaries, because it's much more helpful for the patients to find the right dose. And then if that was not enough, they can always come back, speak to the pharmacist again, and find a better dose. So so for me personally, if it is specific about, I would like to work with you and I'd like you to walk me through dosing and whatnot, there is charges for the patients I work with, but if it's general questions, we're always happy to answer them for free.
No, I agree. When we start to use this as medicinal with a specific therapeutic intent, I think it's important that we incorporate everything we know about the patient, their current medical history, their past medical history, their drug lists, as you guys have pointed out. So those are wise words for our listeners. Dr. Peterson, we're going to leave you with the last comment. I want you to address our clinicians. What do they need to know? And then my intent is to invite you guys back, either in person or do a very organized and structured educational benefit for our clinicians, who I can tell you probably know less than I do, because I was going to go and get 5 milligrams after the show. I'm thinking 2 milligrams now, but I'll call Dr. Leah later and find out what she recommends.
Depends on your goals.
Yes.
So to answer the question, if you're a clinician and you're wondering about cannabis, what do you need to know? There's a lot you need to understand about cannabis, including the stigma that is carried with it and the hindrance of high-quality, peer-reviewed, placebo-controlled randomized trials. There's been a lot of bias in the research. About tenfold more money has gone into researching the harms versus researching the benefits. Not to say there isn't benefits. And that you need to have an open mind, realize that your patients are looking for relief, and we shouldn't carry our biases into that. Once again, this is a naturally occurring plant. We should be able to leverage it. It is not perfect. I want you to consider it like any other medication, but drop the stigma. I do want to close, and it wasn't my intention to close on this, but you asked for references for your patients. The organization is amazing. Our goal is to educate pharmacists, but I'm also the chief science officer of the Canigma, so canigma.com, CANNIGMA. You can learn everything. It's to answer people's questions about cannabis. There is an article on the 5 things senior needs to know to try cannabis, and articles all about what CBG is and what CBD is. So we've answered all these questions already. It is not associated with the PCCC. It is just my personal project, but I would highly recommend anyone who's uber curious but doesn't want to dive directly into PubMed, that they go there, and the secret sauce is we WebMD'd weed and put a pharmacist or a doctor or a plant scientist reviewing every article.
Brilliant.
I also wanted to get one more recommendation, just because Cody mentioned PubMed. There's a I'm not affiliated with them, but it's called Cannakis. It's CANNAKEYS. This would be more for the clinicians. This I wouldn't recommend, or providers. I would not recommend this for the patients. It's pretty much like a PubMed, but only for cannabis research, and it's both negative and positive, or undetermined. So it's not biased at all. It gives you, and it's just focused on cannabis research throughout the world. So and I just recommend that if people are looking specifically for cannabis research and they're having issues finding it on PubMed.
Do you find primary
search by condition or cannabinoid? Sorry, Patty, go ahead.
Now, are primary care physicians open to this kind of education?
I believe so. I think there's a secret society of users. You would be one, but you're much more open to discussing that with your physician. But I think, I'm not sure what the prevalence of use is in our community, but I would say even if it's 1 or 2%, we have 600 users, and I will bet probably 10% of our doctors are aware of both their use and the risk and benefits. So you're a senior, you're a user. What do you want to tell seniors like yourself, Patty?
You just have to find a very low dose. I happen to use a vapor pen because I've used it for a number of years, and I can take 1 or 2 milligrams at a time. It's not a lot, and I use it to sleep. And it used to stimulate my appetite, but after using it for 7 years, it does no longer do that. And I don't get into troubles because I don't continue to chase that effect. If you start out very low and you can get what you need doing it very low, you stay low. Don't go high because you're going to chase it and you're going to end up in trouble. I think that's where the biggest problem comes from, is thinking that you can stay on a low dose forever. You just have to learn how to use it properly, and that requires, I believe, someone such as yourself, any one of you, should be able to access the information that we need.
So for our listeners, I want to thank Dr. Lofholm, Dr. Peterson, and Dr. Leah Johnson, who are experts in this field. I think we've just touched really the surface of this issue. I think there's a lot more to explore, and there's a lot more that I think for our clinicians to understand so that they can optimally manage our patient population using, I think, all the tools necessary in the toolbox. So until we meet again, I want to thank our clinical experts and guests. And Patty, thank you for organizing this and giving some valuable information to our senior population. And we will meet again.
And with that, we conclude our 3-part series on cannabis and seniors. We want to express our heartfelt thanks to our listeners for joining us on this informative journey. Your time and attention are truly appreciated. We hope this series has provided you with valuable insights into the world of medical cannabis, especially as it pertains to seniors. Remember, if you have more questions or are considering cannabis as a treatment option, don't hesitate to reach out by using the contact information in our description below. We strongly encourage you to start a discussion with your own doctor about potentially using cannabis. Your healthcare provider can offer personalized advice based on your specific health needs and conditions. If you found this series informative and helpful, please show your support by liking and subscribing to our podcast. Your engagement helps us continue to produce quality content on important health topics. Stay tuned for our future episodes where we'll explore more fascinating health-related subjects. Until next time.